Hey all, today we are discussing drugs such as antacids, anti-cancer drugs, anti-HIV agents, and psychotropic drugs. Antacids. Antacids are typically basic compounds that neutralize the acidic environment of the stomach. They often contain metal cations such as aluminum, magnesium, or calcium. We all know that acid and base react to form salt and water. Baking soda is an antacid and it neutralizes the acids in the stomach. By reducing the acidity of the stomach, antacids can relieve symptoms of heartburn and acid reflux. But it is not a long-term solution for acid reflux. They are available in the form of tablets and liquids. Liquid antacids work better due to greater surface area. Ranitidine is an antacid that belongs to a class of drugs known as H2 receptor antagonists, or H2 blockers. This is the structure of ranitidine. Specifically, ranitidine binds to the H2 receptors on the surface of the acid-producing cells in the stomach, preventing histamine from binding to these receptors and stimulating acid production. This reduces the amount of acid that is released into the stomach, which can help to relieve symptoms such as heartburn and acid reflux. Anti-cancer drugs. Anti-cancer drugs are a diverse group of compounds that target various aspects of cancer cells' biology. Many anti-cancer drugs work by interfering with DNA replication or cell division, which are processes that are often dysregulated in cancer cells. Chlorambucil is an example of anti-cancer drugs. Chlorambucil is a chemotherapy drug that is commonly used to treat certain types of cancer, such as chronic lymphocytic leukemia, CLL, Hodgkin's lymphoma, non-Hodgkin's lymphoma, and ovarian cancer. It belongs to a class of drugs known as alkylating agents. Like all chemotherapy drugs, chlorambucil can also cause side effects, which include hair loss, fatigue, diarrhea, vomiting, and nausea, and serious side effects can include damage to the bone marrow, which can lead to anemia, low platelet counts, and an increased risk of bleeding or infection. Anti-HIV agents. These are used to treat AIDS. They are compounds that inhibit the replication of the human immunodeficiency virus HIV. Many anti-HIV drugs target viral enzymes such as reverse transcriptase, which is involved in the conversion of viral RNA to DNA. Azidothymidine is an example of anti-HIV agents. Azidothymidine, commonly known as AZT, is a medication used to treat HIV/AIDS. It is a type of antiretroviral drug that works by inhibiting the reverse transcriptase enzyme, which is necessary for the replication of the virus. It is usually taken orally in the form of a pill or capsule. Psychotropic drugs. Psychotropic drugs are medications that affect the chemicals in the brain and nervous system and can be used to treat a variety of mental health conditions such as depression, anxiety, and schizophrenia. They can alter mood, perception, consciousness, and behavior. There are three classes of psychotropic drugs: tranquilizers, antidepressants, and stimulants. Tranquilizers are a class of compounds that act as central nervous system (CNS) depressants. Many tranquilizers, such as benzodiazepines, bind to specific receptors on neurons in the CNS that are involved in the regulation of anxiety and arousal. Examples are Compose and Equinol. Antidepressants are compounds that modulate the levels of neurotransmitters such as serotonin, norepinephrine, and dopamine in the brain. They are also called mood elevators. Example, Prozac and Zoloft. Stimulants are compounds that increase the activity of the CNS. Many stimulants, such as amphetamines, act by increasing the release of neurotransmitters such as dopamine and norepinephrine from neurons. By enhancing the activity of these neurotransmitters, stimulants can improve focus, attention, and energy levels. Examples are caffeine, nicotine, amphetamines, etc. Try to answer these questions. Let me know your answers in the comment section. Thank you for watching.